Hello everyone, welcome back to Defense Roger. My name is Sheetal Yadav and congratulations to those who have cleared their SSB. And before you join Army, there is very important and the final test, that is SSB Medicals. So in this video, I'm going to explain everything about the entire medical process, all medical tests, temporary rejections, that is called TRs, what's curable and what's not, and the 42 days rule after being medically unfit, who conduct these medicals, why medicals are so important, and the real problem faced by aspirants. So let's begin with what is SSB Medicals. So after the SSB interview, you must undergo a special medical board that is called SMB at a designated armed forces hospital. This board of military medical officers check whether you can withstand physical and mental stress, the harsh climates, remote deployment with minimal medical aid, and it takes about 6 to 7 days to complete all the examinations and specialist assessment. How the medical board works, let's talk about that. Here's the official process. Candidate recommended by SSB are sent to military hospitals, then they fill the medical form, and then they are examined by specialists in medicine, surgery, ENT, eye, dental, and female candidates are also being seen by gynecologist. The medical board review all specific findings. They declare you fit, temporary unfit, that is called TR, and permanently unfit. Then each candidate then gets a new chest number reflecting their medical outcomes. Why medicals are so critical that everybody talks about. Medically fitness isn't just a formality, it's a requirement because of Army expects you to be in extreme environmental conditions like high altitude, isolation, combat zone, heat, cold, desert, mountains. So if a minor health issue become recurring, it could endanger you and your team. So medicals ensure that only physically and mental robust candidates get inducted. So let's talk about the main medical test, starting with ENT and dental examination. ENT stands for ear, nose, and throat. The board checks hearing, ear infection, sinus issue, deviated septum, which is being shown on your screen, and the common tears are also being displayed on your screen. So many are curable with surgery and treatment. One disclaimer that some chronic conditions cause functional impairment, can lead to a permanent rejection. So let's talk about dentals now. You need at least 14 sound dental points counting natural teeth and functional molars. The common dental TRs are like cavities, severe gum diseases, and tooth decay. Most dental issues are curable if treated properly before the medicals. One tip is that don't ignore dentals. Many aspirants skip it and then get a TR. Then talking about the eye department, that is very important. The eye test evaluate vision clarity, color perception, squints, refraction, and retinal issues. And the important vision standard, like military allow limited refractive errors. Now talking about LASIK and eye surgery. For Army entry, it is allowed only with conditions such as you must be over 20 years old when surgery was done. Minimum 12 months of post-surgery wait before medical can consider you fit. Eye measurement must be within clinical parameters. For some radical procedure, permanent unfit applies. So most 10 plus 2 entries like ND and TS do not allow visual corrections surgery before medicals. This is one of the biggest pithole. Many aspirants get medically unfit only because they do not understand the rule. As getting recommended at SSB is a huge achievement, but for many candidates, the real setback comes later, an eyesight TR in medicals. So if you are facing the same issue, you must know about Preksha Eye Yoga Center in Saket, run by Mr. Kailash, a qualified optometrist. So far, he has helped over 100 plus candidates who were SSB recommended but declared medically unfit due to the eyesight issue and guide them in successfully clearing their TR. Important disclaimer, you must contact him within a definite time frame. This is not a last minute solution. To see real and measurable improvements, you need to give him minimum of 2 to 3 weeks with proper discipline and follow-up. This is not a shortcut. It is scientific eye training combined with professional guidance. You can reach out to him on the number displayed on the screen, or if you are near Delhi or you can travel, you can personally visit Preksha Yoga Center, which is in Saket, Delhi. An eyesight TR is not the end of the SSB journey, just a temporary phase, so stay focused. So talking about the next test, that is blood, urine, X-ray and ultrasound. Talking about the blood test, complete hemoglobin is very important, and hemoglobin level. A very common issue is low hemoglobin, specifically in females, and many candidates get TR due to anemia. Treat it with diet and supplements. Then talking about urine, check proteins, sugar, infection. Minor infection can lead to you to get an TR, and chronic kidney issue will lead you to permanent unfit. Talking about X-ray chest, looks up to these kind of details which is being shown on your screen, and talking about ultrasound that checks your liver, kidney, hernia, gallbladder. Hernia often gets a TR until treated. So talking about surgical and journal medicals, when it comes to surgical checks, the thing which is being shown on your screen are all the tests, and I've often seen candidates getting permanent unfit because of knock knees and flat foot. Then comes the journal medical checkups, that is BP, heart, asthma, and skin condition. Childhood asthma history often leads to a TR or permanent rejections. Then comes the journal test like height, weight criterias. The board check proportions, weight related to your height and age. Underweight or overweight condition often gets TR until they reach to the standards. Following healthy lifestyle and training plan can lead to getting cure to this thing. So make sure you follow healthy lifestyle and proper training plan. And sudden crash diet before medicals is a bad result. So height and weight standard are strict but logical. So let's talk about 42 days rule. So what it really means, if a medical board rejects you and gives you a temporary unfit, so you get 42 days and you get your treatment done and get relevant report done, report for the AMB or RMB, then this 42 days timeline is strict. So if you do not get a report within 42 days, you may be marked unfit in absence. So real life problems, many candidates delay their treatment or documentations and lose eligibility. Now let's talk about the real problem candidate face. Here is what aspirant often struggle with: not doing a proper pre-checkup before SSP, assuming that minor defects are okay, not knowing the policy details, wrong hospital choice at RMB, and getting discouraged after TR. So if you prepare medically just like you prepare for your SSP, you will pass, not just clear. I hope this video finds beneficial to you, and if you have any doubts, let me know in the comment section below, and I will try to bring a medical officer who is served in RMB or AMB and try to discuss some of the critical cases. So till then, take care of yourself. Jai Hind.